Welcome to CIOtv. I'm your host, Mike Stockwell, and today I'm joined by Isaiah Nathaniel with Delaware Valley Community Health, based in Philadelphia, Pennsylvania. Welcome to the show, Isaiah.
Hey, Mike, thanks for having me. I'm so glad to be here. I want to thank you for taking the time out. I want to thank all the listeners out there. I'm coming to you from Philadelphia, Pennsylvania, home of the Eagles, home of the cheesesteak, home of Delaware Valley Community Health. So I'm looking forward to our conversation today, Mike.
Yeah, absolutely, absolutely. And thank you for being a part of today's show. Could you tell us a little bit about yourself and your role at Delaware Valley Community Health?
I would love to. So, a little bit about me. Isaiah Nathaniel, I just happen to be the Vice President and Chief Information Officer for Delaware Valley Community Health. We are a 52-year-old FQHC in Philadelphia, Pennsylvania that run 9 locations. And for those that don't know what an FQHC is, all that means is that we're federally funded by HRSA, the government, through a 330B grant to see underserved patients. So that means you can walk in our door with commercial insurance and we will see you, and you can walk through our door with no insurance at all and we will still see you. And then HRSA makes us whole on that visit. So 52 years of an organization, 350 employees, we see about 50,000 patients per year, and that's about 158,000 visits through all of our service lines. And that's traditional adult, primary care, internal medicine, pediatrics, dental, OBGYN, behavioral health, MAT services, and women's health. And so, through all of that, we are just happy to be a part of the continuity of care for healthcare in the Philadelphia region.
That is outstanding. I mean, and what a great service that you can provide, depending upon, like you said, if someone's insured, no insurance, no one's going to be turned away. You're really just going to take care of everyone in your community from a healthcare provider. So that absolutely outstanding. Can you tell our viewers how you got your start in IT?
That's a really, really good question. I got my start by breaking our home computer back in the early days. I believe it was a Windows 98 machine that my dad had purchased for the family. And the story goes is that I was so inquisitive that I crashed the OS and I created my first blue screen of death. And so my father had to take it to a computer repair person and get it fixed. And then my mom and dad both said, you better go into computers to pay us back for how much we had to pay to get this machine fixed. So that's kind of like my journey into the IT space. But more traditionally, I believe it's just a calling of mine. I really love the technology space. I really love the ability to affect people, and specifically in healthcare with technology. And so I wake up every day with the goal and the vision to be able to say, you can walk through our doors no matter who you are, what is your socioeconomic status, and make sure you see our providers in a quick time, but also make sure that your experience with us through our technology is equitable to you.
What a great story. I'll tell you, I hear many, many different ways that CIOs such as yourself get their start, cut their teeth in IT, but that one's a first, right? So that's great that everything worked out. You answered your calling, and here you are today. So can you tell us about potentially some initiatives you have coming up from an IT perspective? Anything that you could share?
Absolutely. Yeah, I think that cybersecurity is always an initiative for anyone that sits in this seat or in these positions nowadays. I think a couple of things I would love to talk about is some of the things we did prior to now. And one of the things we are so proud about is that we were able to reimagine our data centers. We were able to reimagine the healthcare visit for our patients. And so, what does that mean? That means we completely redid our data centers to be virtualized from hyperconvergence perspective. We were virtualized on the traditional virtualization stack, but we thought that we needed to do something innovative. We knew that our storage costs were starting to creep up. And so we said, let's dip our toe into the hyperconvergence. And then instead of dipping our toe, we just jumped in head first and did a complete dive into hyperconvergence all the way down to our storage stack. And in addition to that, we redigitized all of our patient intake forms. So we took our institution and we said, hey, we can't see patients through a pandemic or afterwards, since we're in this hybrid fashion. And so what we would like to do is make sure all of our forms from the pre-registration perspective are all digitized. We want to make sure we do a lot of innovative things as far as pre-check. And then from the check-in perspective, we added kiosks to our centers where we did not have that before. We added patient intake management platforms that tie into our EHR. And then we're also looking in the RPM space. And when I say RPM, I'm talking about remote patient monitoring. So we have some great relationships about how we can continue to see patients in a primary care fashion, but when they're home. So our patients are now not just all coming into our buildings, they're also being patients of ours at home. And so how do we make sure that we really, really see them where they want to be seen? And that's one of the things we found through the pandemic, is that our doors are beyond just the four walls in all of our 9 locations. They're really just wherever the patient is.
Well, that's a great way to maximize the use of technology. Very impressive background. I love how you got started. But that's all the time we have today. So thank you once again for joining us on CIOtv. Well, that's a wrap. We look forward to seeing you next time on CIOtv.